Good evening, everyone. Very warm welcome again to our special edition of School of Thought, Sustainable Horizon, the space where we look past the charts, data, and policy frameworks to uncover the human heart behind the world's biggest goals. And this exclusive education forum is powered by IPRH. Uh, IPRH is an educational and research consultant center founded by Professor Dr. Mohammed Shairis Parvez. He is the CEO and the founder of the organization. It is government registered organization and its objectives are to advance and spread knowledge of various national and international business settings and trends through research, academic collaboration, and business engagement. The main goal of the IPRH is to enlighten the independent perception of individual thoughts by sharing research, news, and providing training and brainstorming and research project consultation with innovative ideas and organize talk shows with different research people from different areas around the world. So interested true research scholars are most welcome to join IPRH and follow this page and share your innovative ideas and research and contribute to the society and the world because IPRH believes that knowledge is power. In align with IPRH mission and vision, in this forum we talk about education and lifestyle. Today, our conversation centers on a promise that touches every single one of us at our most fundamental level Sustainable Development Goal number three, which is all about good health and well being. When we talk about good health, it is easy to focus strictly on clinical spaces like hospitals, advanced medicines, and the absence of physical disease. But true well being is so much bigger than a medical chart. It is a holistic, deeply human reality. A true healthy community is one where a person's background or a zip code doesn't dictate their life expectancy. It is an environment where the air we breathe and the water we drink sustain us rather than make us ill. And perhaps most importantly, it is a society where we no longer leave emotional and mental well being in the shadows, but treat mental health with the exact same agency, compassion, and dignity as physical health. And achieving SDG 3 isn't just a technical challenge for doctors and policymakers, it is a moral call to action. So it requires a heart led commitment to equity, ensuring that thriving health is never treated as a privilege for the few, but as the fundamental right for all. We are joined by an exceptional panel of voices who are working on the front lines of community education, mental health advocacy, and wellness equity. Together, we will explore how we can build a world that doesn't just help people survive, but truly empowers them to thrive. So let's open the floor and begin the vital conversation. Please join me in welcoming our guest tonight. I have three iconic women. Yes, Dr. Virginia Rivera from Petrosica and Dr. Alka Mahajan from India and Professor Dr. Binu Thomas from India. Thank you so much for three women, powerful women joining us tonight. I feel honored and empowered. And let me begin our show with our first speaker, Dr. Virginia Rivera. Yes, she is from Puerto Rico. She is an internationally recognized entrepreneur, economic development strategist, architect of global business ecosystem, more than 20 years of experience advancing entrepreneurship and education across Puerto Rico, USA, India, Europe, Australia, and many more countries. And she is the CEO of International Internship University, President of World Education Policy, co-founder and chairperson of Mahila Udemy Foundation, co-founder of Muro Emperente Latina, vice president of Pius Group of Companies and Trust, and she was the Women Entrepreneur of the Year 2025. And today she is there for us to talk about an important topic about this SDG 3. A question for you, ma'am. And very good evening. How are you doing this evening? And you were in the middle of traveling. Thank you so much for joining with us.
So thank you. Namaste, everyone. Hello, everyone. Good morning, good afternoon, good evening, wherever you are around the world. I am very, very happy to be here with all of you. And yes, I am in the middle of the airport right now.
Yes,
My flight was delayed, so I didn't program myself exactly the way I should have, but I wanted to be here with you today.
yes.
So thank
Thank you.
you. Yes. Thank you. Thank you.
Yes, thank you so much for joining. And you have so much experience with the world and every part of the world you're working with. So I would like to ask you, why does a person's zip code still dictate their life expectancy in a world of advanced medicine? Yes, the floor is yours.
Thank you so much. And I think this is a really interesting question, and I think one that is very urgent for all of us to evaluate. I want to, first of all, my sincere gratitude to the IPRH Oman, to project leader Mrs. Shiyama. I hope I got your name correctly, Marikkar, and to Professor Dr. Chaidas Parves for creating this important platform for dialogue and action. As you read, I do work in different areas. I work in Latin America, I work in the Caribbean, I also work in Africa and in India, and of course, Europe is part of it. But these other countries truly still are very challenged when it comes to life expectancy, right? And we definitely can see how you pose the question, how zip codes dictate who will live more and who will live with a better quality of life. So, as we gather under the banner of Sustainable Horizon and Sustainable Development Goal 3, good health and well being, I think this question is really, really pertinent. And I'm going to ask it again because it's a troubling question. Why does a person's zip code still dictate their life expectancy in a world of advanced medicine? As we think about this for a moment, we realize that we live in an era of extremely extraordinary medical advances and innovation. Artificial intelligence can help diagnose diseases earlier than ever before. I mean, we can catch it when it's just starting. Advanced surgical procedures save lives. New treatments and technologies continue to push the boundaries of what is possible. Yet, despite all of this and these remarkable advances, where a person is born, lives, learns, and works often remains one of the strongest predictors of how long that person will live. The problem is not that we lack the medical knowledge. The problem is not that we haven't advanced, we definitely have. The problem is that we lack medical access and we don't all arrive the same time. I want to just set an example from where I come from. In 2009, in 2017, we had a devastating hurricane Category 5 in Puerto Rico. And the truth is that we live under the United States, right? The truth is we are a colony of the United States, probably the oldest colony in the world.
Mhm.
And we were able to get humanitarian aid and travel, but I have to say that 4,000 people lost their lives during this time. Nonetheless, more than 10,000 were able to go out on these humanitarian aids planes and flights. And it all came down to access, and it was very sad to see that those that did not have the correct access or the correct zip code did not survive. And this is something that we have to work with as a country still. We're a very tiny island, but it's something that still haunts us as citizens of this island. As an educationist and as a social entrepreneur and a social venture capitalist, my biggest thing is to try every day to equalize, right? And definitely education is probably the most important key. I have learned that health outcomes begin long before patients enter a hospital. They begin in a classroom, they begin at home, they begin in their communities, they begin with opportunity. A child that is growing in a safe neighborhood with quality schools, nutritious foods, clean water, economic stability, and access to health care, constant health care, has a vastly different future than a child growing up without those resources. And I'm not telling you anything that you don't know, actually. I'm not saying anything that is not historical. Yet we're in 2026 and we're still here. And we still have the same problems and issues, and this is why I appreciate your question so much. They're suffering because access does not exist for everyone the same. A mother may know her child needs medical attention but lacks transportation to a clinic. A family may understand the importance of preventive care or alternative care, but cannot afford that service because usually that is not covered by any type of life health insurance. A rural community like the ones where I work in and I live in may have dedicated healthcare workers but lack the infrastructure, the technology, and the facilities necessary to serve its people effectively. This is why educators must view health not only as a medical situation or medical issue, but as a developmental issue. Education and health are deeply interconnected. An educated girl is more likely to make informed health decisions. An educated mother is more likely to ensure her children receive vaccinations, proper nutrition, and preventive care. And an educated community is better equipped to prevent disease, adopt healthy practices, and advocate for better services. My experience is in James International School, we have a 450, around 500 student school in Kunda, India. And I have to say that for moms, when they were terminally ill, it was totally because of lack of access and other traditional cultural norms, which made them extremely modest and would not seek attention. I was able to, in a conference, explain how unfair this is when at home we have access to all of these things, and yet women still die from, let's say, breast cancer. Probably one of the most prevalent reasons why women die today. But the truth is that examination and prevention, but education, self awareness, self examination continues to be the key. In my suitcase today, I'm very happy to say that I am bringing with me as I go to India a device that was created by a Latina woman in the United States of Cuban descent, a device that allows women to screen early on with a device that's no longer than this. So, right now in my suitcase, I have a portable mammogram machine. This is wild. And really, I'm extremely excited about this news because I can take this device this big. anywhere, and we can serve our communities. We can do our health camps that we do every 3 months, and actually now proceed to at least the preventive time, and also to catch any small masses or tumors that are arriving, or that are just being formed. So there is advancement, but what if I wasn't at the right place at the right time to get this device? And the truth is that when I spoke with India, they don't have this device. And I'm thinking such a technologically advanced, I'm in my area, in my community, technology advanced country where medicine is one of the three top reasons why people go and visit, right? Medical tourism. And it's because of access. So this is a clear example of why our zip codes still dictate who lives better and who lives longer and with what quality. As someone who has spent more than 2 decades working across education, entrepreneurship, and community development, I have witnessed firsthand how health outcomes improve when we invest in people before they become patients. And I will bring it back to school. We have been able to use our school to bring parents in to our health camp and actually address issues like poor vision, high blood pressure, high sugar in the blood, issues with pain and pain management and wound management. This is every 3 months, and this is just two people trying to create a difference, right? So I think that even if we believe that schools are just schools, schools are so much more than that. Schools become the focus of a community. It becomes the mainstay of a community, and most importantly, the heart of that community. And we've been able to use this. So I'm sharing this because it doesn't have to be that a zip code dictates this. I think it takes effort, and sometimes it's so much easier than we think. This is the philosophy behind the work that we are advancing through the Mahila Odiami Foundation, eVillage, James International School, which I was just speaking about, and International Internship University, and World Education Policy. In India, and this is just an example, through the Mahila Odiami Foundation and our work in eVillage, we are building more than programs. We're building ecosystems. So I'm not only bringing the doctors in, we're also bringing the healthcare practitioners that can actually follow up, can actually go into the village and speak, and just check. Because it is not top of mind, not because they don't believe in it, just because there wasn't anything around. So we've been able to cause change, and I think all of us can do that in our areas. Some may view this as an economic empowerment initiative, and that is true. Those communities that have more will have better systems, but the truth is that it's not always the case. It's truly the communities coming together. It's truly using education to our advantage, to realizing when I should go to the doctor, what do I need, when should I bring my child to the doctor, when do I need care. A lot of this is not discussed. And I think that it starts with this. I view it as a health initiative. And I really appreciate you inviting me, because when a woman gets access, in my case, to education and to income, she invests in healthier food, healthcare, sanitation, education for her children, and a more secure future for her family. And when we have secure families, we have secure communities. So the impact extends far beyond the individual woman that we address in Mahila Yami. Because when we educate and we really bring information and access to these women, it reaches their children, it reaches their households, it reaches their entire communities. And this is why we often say women are infrastructure, not intervention. And definitely, we're not here to speak about gender parity or gender equality, but it does affect
Yes, exactly.
how we respond and how we prevail, when access is available or it's not available. Think about it. When women thrive, families thrive. We know that 9 out of every 10 situation of care is done by a woman,
Exactly. Very well said.
you know?
Very well said. Yes.
Yeah, and so if she is not informed and we're not constantly bringing information and access to her, it's very hard for her to understand what is available today. So I truly believe that in every corner and every area, wherever we are standing, we can actually do something about this. We know that when communities thrive, health outcomes improve. That means better workforce, better economic results. Everything has a ripple effect. For example, at James International School, we see another critical connection because education is not simply about academic achievement, it is about preparing healthier, more informed, and more resilient citizens for the future. I want you to all know that India and Africa right now have the biggest promise because of their workforce size. In 20 years, they're going to have a robust, strong, and educated workforce. But wouldn't it be great if it was also a healthy workforce? Right? So, this is why these topics are so important. But it needs to go beyond just speaking about it, it needs to really transmit and transcribe and more than anything become accelerated action. Accelerated action is where am I today? How can I contribute? How can I be part of this information gathering or information sharing or bringing resources to? It's actually still up to all of us. Through our International Internship University, we do a lot of workshops and we connect educators, we connect researchers, we connect healthcare professionals, we connect policymakers, entrepreneurs, and social innovators from around the world. And this is really great because together we are creating global platforms that are addressing these issues. And if I can tell a group of doctors that is actually attending one of our seminars the issues that we're having in Botswana and Africa, this is access to information they probably did not have. This is why everything that we do contributes. So whether we are working with rural communities in India,
Yes.
educators in Africa, women entrepreneurs in Latin America, or just policy leaders from across the Middle East and beyond all over the world, the lesson remains the same. Access changes outcomes. When people gain access to education, opportunity, information, and supportive systems, health improves naturally. Communities become stronger, families become more resilient. This is why we can all impact. It's just not the fact that we have advanced medicine. It's the coupling of advanced medicine with access and the average, regular, ordinary citizen. Then when we get together, we make extraordinary things happen.
Thank you so much. Thank you so
Yeah,
much, ma'am, for your wonderful insight. And yes, I think there's so many things that you shared with us. Not only we think about that advanced medicine, sometimes it's not accessible to all people, but the first most important thing is the acknowledgement. Just right, they
absolutely.
have to learn about the things
Yes,
because then in your personal life experience you beautifully mentioned about that mammography, these things you are carrying an equipment, a tool with you. So this is a new thing. Maybe today, from today, women who watch this session, they can now think about it, buy something for yourself, even if you
absolutely.
haven't, yeah, didn't know about it before. So in this way, first thing is that acknowledgement and then community involvement, so that later comes that the expenditure and all, right? Thank you so much for your
Thank
insight.
you. Namaste. Thank you.
Thank you so much. And with this, let's move on to our second speaker. She's Professor Dr. Alka Mahajan from India. She is a distinguished educational leader, certified psychotherapist, and seasonal broadcaster with over 3 decades of experience dedicated to human transformation. And she is the founder and CEO of Chilpaco International, editor in chief of Tenacity International, spiritual healer and tarot expert, global advocate for mindfulness and soulful living, country head of IPRH India, and it's our great honor and pleasure having you, ma'am. And you are a person who is working and who is with mindful living. So I would like to ask from you a question. Uh, can a community truly be healthy if its emotional and mental health well-being is left in the shadows? Very good evening, ma'am.
Thank Good evening. Thank you so much. Before I say anything, I would like to, from the bottom of my heart, I'm very grateful to IPRH, Professor Shahriar, and you, because it was a very heartwarming invitation, and I just couldn't refuse. And anyway, it's a big, huge pleasure to always be on the platform. So thank you so much. And this question is something which is very close to my heart because, like you said just now, it's something that I'm doing. And I'm doing not only for myself, but for the people around me, for organizations, not only in India, but mostly also in the UK. Uh, but before I begin, I would just like to ask all of you to just close your eyes and just imagine, take a deep breath and imagine a beautiful constructed bridge. Now, it has pristine concrete lanes, gleaming steel arches, and freshly painted guardrails. From a distance, it looks flawless, beautiful, but a masterpiece of modern engineering. But beneath the surface, hidden in the shadows, the foundational pillars are quietly cracking under the structural stress. Now, how long before that bridge will actually collapse? We need to think about it. In fact, for decades and decades, we have treated our communities exactly like that bridge. We measure community health by tangible, visible metrics, economic growth, low crime rates, physical infrastructure, and the absence of physical disease. But today, I want to ask a very vital, uncomfortable question. In fact, I'm repeating what Ms. Shyama just now said. Can a community truly be healthy if its emotional and mental well being is left in the shadows? Authentic answer, short answer, honest answer. No. No. No, it cannot. You cannot have a healthy body if the mind is broken. You cannot have a healthy society if its collective psyche is fractured. Now, when we ignore mental and emotional health, we aren't just ignoring an abstract concept. We are ignoring a foundational pillar of human existence. Leaving mental health in the shadows has real tangible costs, that ripple through every layer of the community. There's something that we need to think about. The economic tolls, untreated anxiety, depression, trauma, they don't just stay at home. They actually show up at the work as absenteeism, as probably lost productivity, and even burnout. So this emotional distress isn't addressed. It breaks down communication in homes. That is why you see those, that every member in the family is sitting, but nobody is communicating. Because somewhere deep down, they all are living their own battles. They all have them, but they're unable to express them. And this is something that we seriously and really need to look into. You know, it passes generational trauma down to our children, which creates a cycle of silent suffering. We talk about this generational trauma. How does it happen? It has been happening. It has been happening since decades, and probably it will go on happening if we don't address the issue immediately and we take steps. So it starts with only one person, but it goes on, every single drop counts. Now, when people feel isolated, unsupported, emotionally depleted, what happens? Community cohesion erodes. Trust vanishes, it's replaced by polarization, a lot of anger, and alienation. And that does not create a beautiful world. It does not create a healthy world. It does not create a world where everybody is happy, peaceful, everybody is using all the resources that are available to them very freely. It doesn't. A community with high GDP but skyrocketing rates of loneliness, addiction, and despair is not a successful community at all. It is a community in crisis. It's masking its pain behind a veneer of prosperity. On the face of it, everything glitters. But then again, we have to remember the old age adage: all that glitters is not gold. It's a huge favorite with me because most of the time, these are the kinds of people and communities that I'm in or meeting. Everything seems so wonderful, but people forget to question that there was something amiss, that there seemed to be a vacuum with a person, a community, a society. Why weren't they happy? Why weren't they happy from the inside? So now, why do we keep this kind of pain that we have within us? Why do we keep it hiding? Why don't we express it? If the cost is so high, why do we continue to look away? So, the stigma of vulnerability is one reason, because we live in a culture that often equates emotional struggle with weakness. We may talk about it all the time, but it still exists. We are taught to, when the going gets tough, the tough get going. We're asked to tough it out, we're asked to shake it off. But a broken arm, a leg, any part of the body is easy to see and easy to empathize with. But a broken spirit, my friends, a broken spirit doesn't show up on an x ray. So we need to do something about that. And it's high time we wake up. Who's going to look after the broken spirit that is here? Who's going to look up that, oh no, this is a facade, the happiness is just a facade? Who's going to look into that? So, what needs to be done? We need to shift the paradigm from the shadows to the sunlight. How to do that? In truly an actionable way. Not just walking the talk, but actually not just talking the talk, but walking the talk. So build a truly healthy community. We must drag emotional well-being out of the dark and integrate it into the very fabric of our daily lives. Now, this requires a shift in three major areas. First, we need to normalize conversations. We need to talk about mental health as fluidly as we talk about physical fitness. Going to therapy or asking for emotional support should carry the exact same social weight as going to the gym or seeing a doctor for the flu. Mental health resources cannot be an afterthought or a luxury to the privileged. True community health means integrating mental health counselors into schools and workplaces. Now, we may have, counselors at schools and colleges, but they shouldn't just be there. They should also be in the organizations, in the corporate world, in the media world. And I am doing that. I'm changing that. Why? Because when you actually talk to them, they're doing a great job. They're getting great money. They have added so much, to the organization with their talent, with their skill. But if you look at them and talk to them, there is something that is missing. There is a void. There is something that they're lacking from within. What is that? They're mentally not well, and nobody's talking about that. In big media houses, I work in the media, so I know how it
Very,
is. I
very
can
true.
see most of them who are very, very unwell. So we have to design urban spaces that foster human connection, green spaces, and peace, and ensuring that crisis intervention is compassionate, and readily accessible. So there has to be a therapist who is there all the time. People need to start looking into this. They're ignoring it. If you talk about holistic wellness, this is okay. I have work to do. No, if you are not well from within, how are you going to do all the big things that you're talking about? It's as simple as that. That is why mental health is so important. That is why it needs to be brought out. That is why it needs to be made super important and placed along with the physical one. It cannot be left in the lurch, in the shadows. It needs to come out. We must value empathy, active listening, collective care. We talk about it, but we're not really doing it the right way. So that is why holistic wellness Holistic coaching is so important, even for the best of us. The best of us are also suffering, let me tell you that. I have met so many of them, I don't want to name, but this is an area that is seriously not being given any kind of attention. Because success is measured by how well we care for our most vulnerable minds. And we need to have a community that is not merely a collection of buildings, beautiful parks, roads, beautiful buildings and financial transactions. We need a community, a network of human hearts, with souls and minds. So if we continue to leave emotional and mental well-being in the shadows, my friends, our foundations will continue to crack, no matter how shiny the surface is. We need to choose to bring these struggles into the light. If we choose to listen, to validate, and to invest in psychological safety, we can build something which is profoundly resilient and tenacious, as I always say, and we can become unstoppable in our own way. So let us stop building bridges that look good only from a distance. Let us build communities, countries that are strong from the inside out, where no one has to suffer in the dark. And, as Michael Jackson says, heal the world, make it a beautiful place, not only for you, for me, but for the entire human race. God bless you all. And I hope it made some sense to all of you. Thank you
Yes,
so much. Thank you.
thank you so much. Thank you so much, Professor Dr. Alka Mahajan. That was a very powerful message, and indeed, it's a need of the hour. We must say that we most of us we ignore the mental health, right? We don't think too much. Even things happens,
Yeah.
we don't put too much effort to talk about it. But please talk about it, have discussion, and find a solution for that, so that even the people who work in the corporate world and they
Oh,
suffer
yes.
from so many things, they don't speak up. And you can see they call it stress, right, all the time when we ask about it. And
Gaslighting, narcissism, manipulation.
yes,
It hurts
yes,
them all the time.
all the time. And they suffer and they don't say it out loud, but every problem has solution. So please talk it and say, give the important, as Dr. Alka mentioned, that give importance to your mental health also, same as the physical health you take care of, isn't it? Thank you so much, ma'am. That was very powerful message. And with this, let's check on our Dr. Binu Thomas. Ma'am, are you with us? Any problem with the connection? Is she there? I cannot see her.
She's not there.
Any issues with the connection? Let me check. Uh, hmm, let's give 2 minutes for her. Just check. Hmm. And I think meanwhile we have a questions there. I saw a Professor Mihir has posted a question, and can we have the question now? Okay, she has a problem joining in, and she says, Professor Mohammed Shairis Parvez, are you with us? Can you please let her in? She's waiting. Dr. Binu is waiting. The problem is today, sir is away and he's dealing everything in his mobile phone. So maybe that can be the issue. And she's there. Uh, okay. Can we have the question? I saw, but I cannot remember the question exactly. Something about the good health. Maybe sir has also got disconnected. Seems like that. Oh, Dr. Virginia Rovai. Can you see the question, Dr. Virginia? Should I read it out for you? Yes. Why universal healthcare system could not ensure healthcare in third world countries like India, Pakistan, Bangladesh? Is it the faulty system of delivery service or something else? Yes, first let's talk to Dr. Virginia. Yes,
So, why is healthcare not accessible to everyone? So,
yes.
healthcare is a business,
Mm.
and we have to be very, we need to understand that healthcare is a business. And if resources are not available, it will not happen on its own. In this case, definitely policymakers and governments are the ones who have to step in and make sure and guarantee that everybody, every citizen that is registered and that is part of that country is protected under universal health care, which is probably what we should be doing. But I do know that where I come from, healthcare is not a guarantee. The healthcare system is a very profitable, money making business. And other countries that do have universal healthcare also have challenges, but they do provide healthcare for everyone. The most important thing I think we need to realize right now is that health is just not the lack of illness, it's dignity, right? It's a different thing. And I agree with you that the fair thing would be that everywhere around the world, everybody would have access to universal health care. But just agreeing with what Dr. Alka said, it starts with prevention, it starts with mental health. If we can take care of our mental well-being, I guarantee that the majority of the diseases that our bodies are battling today would be eradicated. So again, it starts with education, because I mean it is a great dream that everybody would be covered under universal health care. But I think that more importantly, and we need to all focus on this, is in prevention and in mental health, because that is going to eradicate all the problems that we're having with these very serious diseases that are usually autoimmune, or they come from stress related. There's something that really worries me, that burnout is a badge of honor. And we applaud the person that does not rest, that does not dedicate time to them. We think that those sacrifices are good things. And the truth is that does not help. So, although the question is about healthcare systems and why third world countries have no access, this is something that the policymakers, the communities, and the country have to work on. But something that we can work on, and I'm very big on where can we impact? Where
Thank
can
you
we
very much for
impact?
that. Yes,
Yeah. So,
for that insight, and I hope that she clarified your question. And with this, let's move on to Professor Dr. Binu Thomas. We are glad to see you again here. I
Yeah,
was worried a bit. Yes, what happened
I
to the
was listening.
yes
I was able
connection?
to see all of you. I could hear you also. I don't know why I
Uh-huh.
was not inside. That's the only problem. Anyway,
Okay,
now I am
okay,
in.
okay.
Okay,
Thank you
thank
so
you.
much for waiting with us. Yes, let me introduce our third guest today, Professor Dr. Binu Thomas, all the way from India. She is ex-dean, a registrar at Sikkim Professional University, HOD at DPSRU Delhi, and she's an MA in Travel and Tourism Management, an MA in Sociology, an MPhil in Sociology, PhD, and BEd. And Dr. Binu Thomas Chandy, she is a renowned mentor who played a significant role in the student's life and education for 35 years in Sikkim, yeah, Sikkim, and she's also an author, a very popular researcher, and she is a reviewer of the International Journal of the Climate Change by Common Ground Research Networks, USA, resource person for national and international seminars, and she has published papers in national international journals, and she is also an editorial board member of the Asia Pacific Journal of Advanced Education and Technology, board member of Doctoral Committee of Sikkim Professional University, and she's also the member of the International Organization of Educators and INC IOER, and also the award winner of the best papers. And ma'am, you have a vast experience with university students, and you also have experience about climate change and things about our environment. So I would like to ask you, how can we protect human health when the very air, water, and the climate around us are falling ill? What's your take on this?
Thank you, Ms. Shama. I'm very grateful that I have got the platform here today with the eminent speakers. And I thank the CEO, IPRH, Professor Mohammed Parvez, and the dear host Shama Marikkar, because we had worked in different. I had worked with Shama in the different sector also together for a very long time, and Dr. Virginie is also a very close friend of mine. We met in
Yay.
Delhi, so nice. And Dr. Alka also I have seen in different um, uh, sector. So I'm very happy I'm with the eminent speakers here today. And the topic, as I said, is a very important topic, which is we have discussed about the psychological aspect, and Dr. Virginia, who had spoken about the education importance of education, healthy citizen, and about holistic wellness, etc., which is all very important aspects for the society. And the same is the way my topic, my question to be answered here is about human health when air, water, climate around us are falling ill. So this is basically the need of the hour today for each and every country or every place in the world. So, as we said, protecting human health and environmental degradation requires proactive personal mitigation and systematic public health intervention. We need to educate the students right from the grassroots level. So, which I was doing here, I was working in Sikkim. It was a Scottish missionary school when Sikkim was a small kingdom, not a part of India. It was a small kingdom. It was run by the missionaries of Scotland. So I have been very fortunate to work under the Scottish missionary, and the principal also was Scottish missionary. And then she had always given importance for the environment that was there in Sikkim and in India. She being from Edinburgh, so it was always a nice opportunity for me to work on this area. And over the time, I had worked in a place, Sikkim is a part of India from 1975. And as you say, as it's been said, that is the most cleanest place in around the world. If you talk about, it's the most clean and organic vegetables that we have. And I had the opportunity to be there for almost 36 years of my life there in Sikkim. So we had very less issues about health, human health and environmental degradation, as there was very less population. But over the time, last 3 years, I was in Delhi, and I could feel the difference that what we had in Sikkim and what we had in Delhi. And right now, for the time being, my hometown is Kochi. So it is again in intermediate, that is not very polluted, not very clean also. That it's a very nice place. Yeah. And regarding this pollution that I have mentioned just now, uh, we need to have personal mitigation and systematic public health interventions, such as monitoring is very important at different levels, ensuring safe water access and building community climate resilience. To safeguard health when air, water, and climate are compromised, implement these evidence-based strategies. Now, when we talk about air quality mitigation, you have to track real-time pollution and filter indoors to reduce particulate matter, and wear high quality N95 mask during severe smog or wildfire, even to align with the air quality guidelines. So, as we were discussing about me being in Delhi for a small period, that is for 3 to 4 years, where I met Dr. Virginia also there for a conference. So, so you must be thinking, I don't know which other places you have been, nearby places, Rajasthan, or I think you had some Mahila project working. So all these places you find highly polluted. They are all highly polluted places, and we need to wear N95 mask and to protect the air quality. And we used to have plants to keep the air inside the indoors also to from pollution, which I have never experienced. Last 35 years since I was in the heaven, to be frank, Sikkim being a very beautiful place without pollution. And when we talk about water safety, testing drinking water regularly for contaminants, especially heavy metals and pathogens. Use water filtration systems certified by, international NSF to remove specific local pollutants. There are so many pollutions that you find in the water. Then we talk about climate resilience. You have to adopt heat health action plans during extreme weather. We have extreme weather in India, especially Delhi. You have very extreme weather. But when you go to the northeastern states where I lived, you have a very severe winter also, say maybe 4 to 5 months. But you have to see, you have to explore resources from climate and health program for strategies on preventing vector-borne diseases and managing heat stress. Now, how can we protect our health from air pollution? So here are some simple, effective tips for protecting our family from the dangers of outdoor air pollution. Check daily air pollution forecast in your area. That is what we were doing when I was in Delhi. I used to check this. We used to check this, and then we see that when highly polluted, when it is too highly polluted, we always try to keep indoors or to wear a mask and keep ourselves protected from this pollution, and avoid exercising outdoors. And I've seen people when the pollutions are high, also they go around in the grounds nearby. Also use less energy in your home so that there will be very less pollution outside. Now, another thing is, how can humans reduce the impact on water and climate? Eating more vegetables, fruits, whole grains, legumes, nuts and seeds, and less meat and dairy can significantly lower your environmental impact. Producing plant-based foods generally results in fewer greenhouse gas emissions and requires less energy, land, and water. Now, what can an individual do to reduce personal health risks from air pollution? So, this is something that need to start from the grassroots level. As I said, when I worked in Sikkim, we had this nature club where we teach the students right from the junior class itself. You need to plant more plants. You have to have a healthy atmosphere outside. Same thing, I had worked in Australia also for 4 to 5 years, where I found that they are very much concerned about their well-being. They are not allowed to throw papers, like as you see in, I'm very sorry to say, Dr. Virginia, in India, especially in Delhi, I see lots of pollution. So, which is which is actually very bad for the whole environment. Now, the temperature rise and extreme heat are already straining the renal and cardiovascular system of millions of people, contributing to global loss of almost 1.09 trillion labor capacity. Now, climate change. When you talk about climate change can also have many social and environmental risk factors for mental health. Exposure to extreme weather events, displacement, famine, malnutrition, anxiety, and distress associated with climate change are all contributing to mental health issues. So, these are things that need to be reduced from the human side so that we can have a very good society, first of all, the generation that are growing right from the schooling till the college days, uh, we are we should encourage the students to have the knowledge that they shouldn't pollute their surrounding, and at the same time, you have to protect yourselves from the severe pollution, say in the capital of India, Delhi, where you have very high pollution, and less say rainfall, which is very thing different from what I had experience in Sikkim and in Kerala, my hometown. So all these, then exposure to another thing is traffic pollutants can be a rational consideration in choosing walking, biking, or exercise routes. In general, traffic pollution concentrations fall rapidly at distance from roadways, approaching background within about 500 meters, assuming no other local sources are nearby. So, various web based applications can assist individuals in finding alternate routes. So, we have to look for alternate. That is, now you have the solar energy coming up. So, there are very less pollution. We are trying to reduce the pollution. Even the petrol consumption, petrol vehicles have been stopped, diesel vehicles have been stopped. Now we are having gas and electricity vehicles, which is over the time you can reduce the pollution in and around your place and give a start for a good society. So until and unless you have a good society or good human ambience, you cannot focus on the progress of the society. Thank you.
Thank you very much, Professor Dr. Binu Thomas. That was very indeed deep and insightful. You shared your personal experience with your students and how you mentored them to take care of the environment. Yes, of course, it's important because it's our duty, and everyone should feel that we have to take care of our environment. And if now the condition is, as you mentioned, it's too harsh now. Some part of the world is experiencing extreme hot, and some part is experiencing extreme weather condition like rain and flooding. So what we can do here is we have to protect ourselves. Also, we have to take preventive measures. Like she said, don't go out for to do exercise if it is too hot. Check before you get out of the house, and then don't throw the things, yeah, like papers and your garbage and all. Just don't throw on the street, and make your place beautiful, keep it beautiful. It's our duty, and it's a basic thing, fundamental thing, that it should be taught from the very young age, I feel, because as a citizens that we should feel it. If we don't think about, at least if we don't do at least this to our environment, we cannot expect anything from our environment, isn't it? So we have to be very responsible and teach our students and children at home even to be more responsible citizen, uh, in terms of taking care of the environment and plant trees. Yes, and it doesn't take much time, and we can do it. And thank you very much, ma'am, for sharing your insight today. And three beautiful women and powerful women from different parts of the world joined with us tonight. And I hope that we all learned something new, and all our audience has something to take away home and think over it. So, as we bring our conversation to close today, I want to extend my profound thank you to our incredible panelists for sharing their insights, expertise, and above all, their hearts with us today. And all of you watching at home, thank you for lending your time and energy to this vital dialogue. And if today's discussion has taught us anything, is that Sustainable Development Goal 3, good health and well-being, cannot be achieved in a all alone one nation or one person, or behind closed clinic doors. We cannot treat the body without nurturing our mind. And we cannot protect human health without healing the communities and environments we live in. True well being isn't a milestone we reach only when we fall ill. It is a daily practice of equity, compassion, and connection. It is found in moments when we choose to listen without judgment, active listening, and when we extend a helping hand to a neighbor, and when we advocate for systems that see healthcare as a human right, not a privilege. And as we step back into our respective corners of the world, let's carry this conversation forward. Let's remember that building a healthier world begins with building healthier, more heart led spaces, right? Where we are in our homes, our schools, or in our workplaces as well. So, finally, I would like to say take care of yourselves, look out for one another, and let's keep striving for a world where everyone, everywhere has the opportunity to truly thrive. Thank you so much.
Thank you. Thank you.
Thank you.
Thank you, everyone.
Thank you. Bye bye.